think I mentioned it to you, Beth. I
I
was
Now,
like,
think, well, you did, but
yeah,
it's because I was saying, I think if I remember correctly, I was saying about like the extra bits and pieces that I always have in my head that I'm going to do, like write a book and do a podcast and run a workshop. And you were like, oh, we do a podcast.
and here we
yeah.
are. Running a
Yeah.
workshop sounds interesting. Is that something? What would you run a workshop on?
So eventually, when I'm brave enough, two things, maybe three. So my work sort of started with working with solely abuse, specifically sexual abuse and the unspoken side of sexual abuse. So I think there needs to be more education around the unspoken side of sexual abuse, the stuff that carries shame, like arousal triggers, and when it doesn't look like it should, and thinking you're in love with your abuser, that kind of stuff. And educating people to not shame other people in that, well, if you thought you was in love with them, then it wasn't really abuse, was it? And if it looked like that, if you're turned on and, just because you're disgusted, just because just from personal experience, when sexual abuse doesn't look like what people can get on board with, you get a lot of odd, very unhelpful comments of how it couldn't have been that traumatic and maybe it was your fault in some way. And yeah. People don't talk about arousal triggers. It took me seeing someone on TikTok talking about arousal triggers to even be able to bring it into therapy. And then what we're talking about today, so trauma for neurodivergent people, because I know from my own journey in therapy, don't get me wrong, my therapist's absolutely amazing, but unless you're somebody who really understands neurodivergence, they don't take into account RSD, PDA, limerence. I've had a discussion on, some people believe in limerence, some people don't. In ADHD specifically, it's a huge thing.
Okay. Have you ever heard of the crappy childhood fairy?
No.
She's Anna Runkle. She's American. She does a lot of work around limerence and all of those
Ah,
things you're speaking about. She's got loads of wonderful podcasts. So she's, just a little signpost there while we're on the subject.
brilliant. Yeah, I first came across limerence with the married therapists. They're English therapists, couples therapists, who now live in America. And he is limerent, became limerent, and they went through their own couples therapy because of his limerence.
Oh,
That's where I
so
first came across it. I was like, oh my God, that's me. I'm not crazy.
no. And it's incredible, isn't it, when you hear something that you resonate with and it
Yeah,
sort of validates your feelings and your experience of things.
absolutely. But it's another experience when you get these light bulb moments and then you take them into therapy and you get, does it need a name? And I'm not really sure that, somebody that doesn't, it's then like, oh. So I think sometimes neurodivergent, well, I think neurodivergent people who have RSD, PDA, stuff like that, they need someone who understands it, not someone who hasn't experienced it and doesn't know about those things.
And also this idea of external validation and how important that is for people with ADHD. So if you go into a therapist and you start talking about your limits and they're not validating what you're saying,
Mm,
you're likely to negate your own belief because, oh, well, that other person didn't believe what I was saying.
mm.
So it can't be true, then I must be wrong. So before we
So I'm
start,
Beth. I'm a trauma therapist and specifically now working with neurodivergent clients that have experienced trauma. And that was sort of a unplanned merge. So I originally started out as a trauma therapist because of my journey, really, because of childhood trauma, because of abuse, because of child sexual abuse, etc., etc., and going through my own intense weekly sessions for 6 years. And previously to that, going through therapy, in and out of therapy for a very long time, never really finding until the age of 38 the therapist for me, and finding out what absolutely doesn't work, especially not knowing at that time that I was neurodivergent either, late diagnosed neurodivergent. And I remember thinking at some point in my life, I want to go out there and I want to do this right because I've experienced some. not so great stuff out there. At the age of 38, I decided to leave all sorts of things, and one of those being my job, and retrain and, yeah, become a trauma therapist. And then as my work, probably about a year after being in private practice, I started to notice that a high number of people coming into me were neurodivergent. So that's when I decided to sort of niche down even more and specifically deal with neurodivergent people with trauma, because well, as an undiagnosed neurodivergent person myself with trauma, yeah, I just seem to get those clients. So I decided that was my sort of niche, and that's the work I do today.
It's brilliant, isn't it? Thanks for that.
In a way, just by introducing yourself today, Beth, I think you've really answered the first question, which is I was going to ask what drew you to working with survivors, and especially neurodiverse trauma
Yeah.
survivors. But what do you wish, like you said, until you were 38, you tried and you've learned now what doesn't work. So, what do you wish more people understood about why neurodivergent people are more prone to trauma and abuse for a start?
I guess I wish people knew. I mean, it was a bit of a light bulb to me to find out that just being ADHD made me more susceptible to the type of people that would abuse you. So, yes, there's childhood. Of course, there is. There's your life script. There's, sort of going back, if you've not had the best upbringing, that absolutely is part of it. But it's not the only part of it. So, having that type of therapy only dealt with a part of it. What it didn't deal with is the other bits that didn't make sense, that then you sort of blame yourself for, but that you can't help. So when I'm dealing with neurodivergent clients with trauma, I always say to them, some of it will be trauma, some of it will be your neurodivergence. So there'll be stuff that we can work with and that can get better for you. There's other things that, as a neurodivergent person, this is part of your personality. So part of it is acceptance, self-acceptance. That if you are rejection sensitive, there's a
Right,
thing called RSD, rejection sensitive dysphoria. If you have that, you're probably not going to reach the idea of securely attached,
right.
because it's part of your neurodivergence. If you have
Okay.
PDA, pathological demand avoidance, that's, of course, self-acceptance will make that better and easier to deal with, but it's still going to be there. And recent events that I've been through have showed that, you think you've gone and done the work, and then a perceived rejection arrives and you're back into all those old coping mechanisms, so it doesn't ever, I don't believe in the word fixed, but there's some things that you have to accept a part of you, and the acceptance itself really helps calm it down.
That's really interesting, actually. And yeah, of course, if only people realized that, yeah, you can't change your personality.
No.
And it's recognizing what is part of you and
Yeah,
what is the trauma.
yeah. Because a
Mm.
big part of it, is absolutely going back and looking at your childhood and all of those sort of inner child things, which I do. But then there's also, like I say, that part of it that you're left with and you're thinking, yeah, I'm better, but why am I still not being able to get out of bed? Why am I having days where I can't function? Why am I, like the trauma? I've gone back and I've done the work, but actually that's part of being neurodivergent. It's not actually that you're depressed, it's that you're overwhelmed, and that you maybe have rejection sensitivity dysphoria, maybe have PDA, and they're things that that if you've got acceptance with, you can allow yourself to have a day or two just to be kind to yourself, and then you're able to function again, rather than having those things and going, oh, well, clearly I've not done the work and I've not got better, beating yourself up and getting stuck in it for weeks on end.
Absolutely,
So
absolutely. You said that having ADHD made you susceptible to certain people and types. So that's why someone with a neurodiverse condition will be more prone
yeah,
sometimes.
limerence is a big thing, that sort of obsessive attachment nature. We tend to, people that suffer limerence, we tend to obsess, really, really obsess over people and not see the red flags. In fact, we probably do see the red flags, but actually what they give us is a dopamine hit. So we're dopamine seekers. So when someone comes in fast and hard in the love bombing phase, it's amazing. It's lightning bolts. It's, when realistically, actually, you probably shouldn't feel like that. Um, Technically, they would be the red flags that you would stay away from. But actually, for us, it's dopamine, it's dopamine, it's dopamine. And then the extreme highs and the extreme lows of an abusive relationship, it mimics drug abuse, really. And neurodivergent people are more susceptible to drugs and alcohol and addiction because of the dopamine highs and lows. So we become addicted to these people.
It's an addiction, isn't it? It's like we think it's love. It's like
But it's
addicted
not.
to love, but it's not.
No, it's an
No.
addiction. And, by the time it's worn off and you're seeing it for what it is, you're kind of stuck, because bear in mind, neurodivergent people will hear so many more negative comments and feedback than the average person. You're too this, you're too that, you're not good enough, you're lazy, you're this. Why can't you just sit down and behave? Friendships are more difficult. So we can tend to be more sort of alone and the odd one out anyway. So then we're more susceptible to accepting unhealthy people because we believe in some way that we're wrong or we're not able to be loved. And, we spend quite a bit of time on and off lonely. So then, the fear is that we'll be alone. So we stick to these people even more when they come
Great.
along. But I think in addition to what we were saying about why neurodivergent people are more susceptible, neurodivergent people tend to, some neurodivergent people can be more sensitive as well. So the things that we think that, like the jokey comments. I mean, for example, autistic people don't really get sarcastic jokes some of the time. They're very matter of fact. So you make like a sarcastic joke, which is supposedly funny, and they've taken it literally, and then that is, you've said something horrible about them, so they're questioning their friendship. And, so neurodivergent people are quite often more sensitive to things. They're living in a world that is overwhelming, so they're always on the edge of their window of tolerance.
This all makes so much sense. How do you, when someone walks in the room, therapy room, and you know that they are neurodiverse, how do you make allowances for that and deal with the trauma? Is there anything specific you do?
We, like I said before, I spend some time sort of saying, look, there's going to be this side, there's going to be the trauma side. Absolutely, we can do something with that. Also be aware that there's going to need to be some self-acceptance, because you as a person are the way you are. And, a big part of the work will be accepting that person, which is really hard because everyone's told that person they're not okay and they need to become normal. But in the therapy room, don't change anything. I don't change anything. My room stays the same. Neurodivergent people, especially autistic people, really struggle with change. So I have a lot of clients that have they have like sessions that are moved around. My autistic clients tend to like to come in same time, same day, and I don't change anything in the room. Always looks the same. I mean, I removed a clock once, and you'd be amazed at the amount of distress that caused because it was really loud and it ticked really loud, and some clients found that overwhelming. So I took said clock off the wall, and then they were like, "Something's wrong. What's wrong in the room?" And it makes them feel unsafe.
Okay.
Change is unsafe. Um, Transitions are difficult for neurodiverse people as well. And change is a transition. They've got to now get used to something. So I don't change things.
Is
And
there anything in traditional therapy that is bad and or that wouldn't work with someone who's neurodiverse that you
yeah, I think for a lot of neurodiverse people, feelings are difficult. Trying to identify it. And, we're taught, aren't we, with our training, so how do you feel? Where is it in the body? How did that make you feel? They're all questions that I don't ask my clients because they don't know. They find feelings really, really difficult to identify.
of course. Yeah, that's so interesting actually.
Yeah.
That brings me on nicely to, so for other therapists that are listening, um, what do you see therapists doing wrong or not doing wrong, getting it wrong or missing something? What do you see as maybe an obstacle when dealing with trauma survivors who are neurodiverse?
Not looking at the neurodivergency, looking at the client as someone who isn't neurodivergent and going back, and trying to heal everything. And you aren't going to heal neurodivergency.
Yeah,
You're just
yeah,
not. You're going to be left with bits.
Can I just come in? And I kind of feel like it's person-centered, really. It's just being person-centered and picking up the vibes in the room, like the
Yeah,
feelings, and kind of monitoring how we're feeling in the room and
yeah.
think like relating that to the client. So it's really is I feel like it's really person centered that
Mm,
you like everyone's individual, everyone's kind of got their own stuff going on. And I think neurodivergence is just a part of that. They've
hmm.
got different stuff going on, perhaps,
Yeah,
or it's harder for them to accept themselves
yeah.
or like you said, because they've been told all their life that you're wrong, you're doing stuff wrong, you're not, you're not good enough.
I hear a lot of the clients as well say, "Oh, I've always been told I'm too sensitive." I get a lot of clients come in and they're like, "Oh, I really want to change the fact that I just cry." And actually, what's happening is a meltdown. They're not too sensitive and they're not because quite a few of my clients find it really difficult to understand why, if they're not sad when they meet confrontation or if they're at a party or if they're on public transport, they want to cry because there's nothing sad going on, so they can't really figure it out. And actually, what's happening is you're having a meltdown. Meltdowns don't look like angry people that lay on the floor and kick and scream, especially in adulthood. No, you know, a lot of my clients would not do that. So their version of a meltdown is that, well, actually, you're on public transport, it's loud, it's overwhelming, there's too many people, someone sat down next to you, maybe your coat doesn't feel right, maybe it's rained, maybe you forgot your ear defenders. You're having a meltdown. And you can't stop meltdowns, you're autistic.
yeah,
But it's about, so not only are you doing the trauma therapy, but then you're also helping them to get coping mechanisms with everyday life. So it's not just about the trauma, it's about, look, you are allowed to carry a fidget, you are allowed to have ear defenders, you are allowed to get off the bus if it's too much for you. You don't have to go to the party, you don't have to socialise. All the things you're forcing yourself to do, which are traumatising you more, you don't actually have to do that. And if you do it, there's coping mechanisms. And I think that when someone comes in with trauma, people look straight away at the trauma, let's unpick the childhood, let's do this, let's, not fix everything. But when actually some of it is neurodivergence, not just the trauma.
Yeah, what Kay said, person-centered, is seeing someone and listening and hearing
Yeah.
them and not judging, accepting as they are,
Yeah.
and helping the person to accept
Yeah.
who they are. Yeah.
I find within reason as well, self-disclosure really helps people as well, because I think people come in and have this idea that you're this put together person as a therapist, and you're like, actually, I'm neurodivergent as well, and I forget stuff, and I have fidgets in my room. The clients will see me use a fidget, and then they'll be like, oh, and they'll look to the side of them and go into the fidget box themselves, whereas they'll come in, see their stuff in the room, not touch anything. But if you, as the therapist, have neurodivergence and you're using a fidget, they'll start to look around the room and go, oh, it's okay if I use one as well then. And then you'll find maybe a little bit later, they'll be like, oh, that fidget I really liked in the room, I bought that and I started using it on the bus or at work, or, just that bit of normality and acceptance makes a huge difference to people.
Absolutely. It's funny that well, you've answered one of the other questions that we had for you, and that it was, how do you learn to work with this group effectively? Well, because you've got neurodivergence yourself.
And
That's
navigating my
a good
children as
start.
well.
Yeah, yeah.
That's how I discovered
Fun.
my neurodivergence, was through my children, and they're doing all the questionnaires and thinking, oh my God.
Mm,
And then
mm.
speaking to my parents, and then, that frustrating moment of, oh yeah, well, you did run around the garden for 2.5 hours after school screaming. I suppose that wasn't really normal, was it? I'm like, oh my God, why did you not check that out? So yeah, it's through self experience, through going through it myself and then through it with my kids, and all the adaptations I put in for my children so that they hopefully don't come out the other end as traumatized as I did. And but also some extra bits of training, because just because you got it yourself and just because your kids have got it doesn't mean that you can only work off experience. So, I have done like additional CPDs and stuff, and finding out about limerence and studying that, and finding out about pathological demand avoidance and studying that, and rejection sensitivity dysphoria. That was a new thing for me, so I had to kind of really look into that. But the more I find out and the more I look into it, the more my own stuff makes sense. And then you can give that to the clients and they're like, I didn't even know that was a thing. Oh my God, there's nothing wrong with me. Thank God.
Exactly, because a lot of people have got low self-esteem because of all
Mhm.
the negative thoughts they've been telling themselves and all the
Yeah.
inner dialogue. And then
Yeah.
that low self-esteem, what are you meant to do with that if you're already beating yourself up and then you get this rejection dysphoria and then you're
Yeah.
already feeling terrible? You haven't got this esteem within yourself to be able to argue back against the thoughts that are running through your mind, have you?
No, no, exactly. Yeah. And you find that once people know these things and they've got the acceptance in the counselling room, they're able to then discuss those things with people near to them. I've got clients that are giving other people books on PDA and on limerence, and then asking the other people to have a little think about the way they talk to them. And, because I will be sensitive to this, there's nothing I can do about it. Could you just maybe, instead of saying you need to do this, reframe it, or, you know,
Is that, isn't it? If it's even slightly not including you, people that are sensitive can feel excluded, even when that's not what the person meant, or they can literally reframe what's been said or written.
absolutely.
And then the other thing is, what was the other thing you just said? The RSD and the, Oh, the pathological
Pathological
demand
demand avoidance and
avoidance.
limerence.
So
Yeah.
the avoidance business is a bit like the counter wheel and the what Dr. Gabor Mate calls the contra wheel. So you sort of rear up. So if someone says to you, take an umbrella because it's raining, you're going to have that feeling of being
Think, well,
told
I'm
what
not
to
going to take
do.
one now.
I'm not taking one then. I don't need an umbrella. You talk
I'd
to
rather be
me.
wet.
I'd rather have wet hair, yeah, than do something somebody else has told me to do, even
Yeah.
though you would have taken it if they hadn't said.
Yeah. And then you hear a lot from people, especially sort of my generation, is, oh, you cut your nose off to spite your face. Why'd you do that?
With no understanding at all that how they delivered that
No
information just triggered
understanding at
you,
all.
really.
Yeah. And I mean, it can happen to the point where even if you're doing something and someone comes in and they haven't seen you're doing it and says, oh, like, can you do the washing up? You think, well, I was, but I'm not now. And you just drop it. You think, that's it. Not doing it now. You've come in and told me to do something I'm already doing. But people don't understand why they like it. They're like, what's wrong with me? Well, nothing is wrong with you.
And it's a
But
condition that you're
yeah,
working with. Because also, sorry, Sharon, was you going to say something? Because that idea of being interrupted when you're mid-flow,
yeah.
that's another thing that sets people off.
And what's interesting is, yes, PDA is attached to neurodivergence, both autism and ADHD, but actually you can get pathological demand avoidance as a standalone diagnosis. And it quite often is bred from having a non-autonomous childhood.
Oh, makes sense.
So, if you've had one of those childhoods where you've had very strict parents, it's while you're under my roof, you're under my rules, I mean, some people even they're not even allowed to choose what they wear and cut their own hair. That was my experience as a child. I was marched off in these awful clothes and with an awful haircut up until like I was about 15, being bullied, begging my parents to, no, while you're under my roof, it's my rules. And I remember thinking to myself, I will never do anything anyone ever tells me again once I leave this house. And I think that was the breeding ground for my PDA. So, yeah, okay, I have neurodivergence, but actually, that complete non-autonomy can cause PDA.
And not
Yeah,
having a label for it. Not
Mm,
knowing that's what had happened.
you don't realize how much damage comes sometimes just from something like that, which
mm,
wasn't meant nastily, but
no,
you had no autonomy. So when you were able to, you took it all.
yeah.
How can friends and family really help to support someone that is neurodiverse, someone that they care about, that is
Mm.
dealing with trauma?
Learn about it, read the books, learn about it a bit. There's lots of free courses and stuff you can do on autism and PDA. I think they do run one now, which is really good at the Rayleigh Mega Centre, all to do with a different type. If you've got young people with, there's a different type of parenting. It's called oh God, I could be wrong, like MVR or something like that. And it's gentle parenting really, but it's yeah. And it used to cost lots. I remember I looked into it, my kids were young, and it was like £6,000 to do the course. And now people are offering it for free. But also, if you've got maybe sort of more grown up people, is just sit with them and listen. Don't try and fix, don't try and find a solution. Don't, have you tried this? Have you tried that? Because neurodivergent people find, they have dysfunction. So, they know what they should be doing, they know what they need to do. Sometimes just sitting with the person and not trying to give a solution, but just listening and saying, what can I do to help? And learning the stuff. I think it's really important to learn the stuff. The same with other therapists. If you're working with neurodivergent people, you need to know about RSD, about neurodivergence, about how it shows up, why they struggle. I didn't find personally CBT worked for me because it was very much do it. Go and fill out this form. and do this task and do this. And then when I came back and said, well, I haven't done any of it, to be told, well, I don't know what you want you to, I don't know what you want me to do for you then, because you need to do the work. And I'm like, but you don't get it. I physically can't. Now I know I've got demand avoidance. So as soon as you say to me, go off and do the work, I'm going to do absolutely everything but do the work. So CBT for neurodivergent people quite often doesn't work.
Okay,
Too much
that's
demand.
really interesting. Speaking of somebody that I do know, not a client, I should add, um, who is diagnosed with BPD,
Hmm.
had DBT, so that's borderline personality
Yeah.
disorder, who had dialectical behavioural therapy and
Yes.
didn't get on with it.
Ah, okay.
It's very much try this, do that.
Okay,
Go,
it's a demand thing then.
yeah. And
Yeah.
actually, because they've got ADHD, to be told to go and do homework makes them go, I
Not
can't
going
do
to do
that.
it. Not
Yeah.
going to do it. Too much demand.
It's so neurodiverse, it seems, well, we know, but is you treat them very differently sometimes,
Hmm.
almost like you say, recognizing that first and then dealing with what they're dealing with.
Yeah.
Mm.
Yeah, it's interesting because I've worked with people that have, two people I can think of have come in and they've said, I've had, a very interesting intro call of like, I'm PDA, you cannot tell me to do anything, you can't suggest anything, you'll be really careful how you word everything, you know, and the PDA part in our relationship and our work has disappeared. They still experience it with their parents, they still experience it in other places. But in our relationship, which is safe, the PDA has it just doesn't rear up in our relationship. No, I can now make suggestions. I can now. And I think a big part of that was identifying that actually their PDA for them was because of their non-autonomous childhood. As soon as they'd got autonomy, understanding, kindness, compassion, it didn't need to be there. It was a part of them that was protective. And if you're safe, those parts can stand down. They don't need to be there.
That's incredible insight, isn't it?
Mm.
Yeah.
Really wonderful.
But see, if you then go into therapy with someone who doesn't get that, and then they're saying, you need to do this, you need to do that, we need to get you functioning, you can't just lay in bed, we need to, all those things, the bits of people that they can't help because it's part of their neurodivergence, that PDA part is never going to stand down.
No, totally makes
Yeah,
sense.
it's a coping strategy, isn't it, that your mind has created in order to protect you.
Mm.
So it sounds like that particular experience, that's a success story um, between you two. They don't experience PDA anymore.
Yeah.
What would you say is a success story outside of the room for you, like with one of your clients or something that's happened to you?
Um, there's a lot. I just think a success story for me is when a client gets to a point where they accept themselves, where they come in and they just go, oh, like yesterday I just couldn't do anything, so I just allowed myself to stay in bed. Was kind to myself, and then I just got up the next day and continued to function. Or I decided that I was having a really rough day and I was just going to do one thing. And as long as I'd done one thing, I was going to then allow myself to rest for the day. So success stories for me are watching neurodivergent people come in as they're this big issue that needs completely fixing, to then coming in and telling me that they've been chaotic or forgetful, or they've had dysfunction, or they've had ADHD paralysis, for example. that they're limerent and just accepting themselves for it, allowing themselves to cry, realizing, I think big one for me was a client that wanted, their goal in therapy was just to stop crying everywhere. And now they're okay with it because it's a meltdown, they can't help it. But in the accepting it, they cry less. So they have got their goal, but just that
Yeah.
self-acceptance. They came in knowing they were ADHD and not wanting to accept they were autistic. Now they're accepting themselves as autistic. They've got a diagnosis and they're wearing their lanyard. They're asking for adaptations at work. They're saying, look, I might cry, but it's just because I'm overwhelmed. Please just carry on with what you're doing. Yeah,
It's that idea, when people have panic attacks and anxiety and they get scared of their anxiety,
yeah.
it's like that fear of
It
crying
feeds it.
makes the crying worse.
Absolutely. Yeah, because they're trying to stop themselves. What's wrong with me? What's wrong with me? Oh my God, stop crying. Like, you're such a baby. I think that, they held those comments that were made in the past.
And that learning to accept yourself, whether it is anxiety and panic attacks or neurodivergence, whatever, learning to accept yourself is what there's that famous saying, isn't there, from Cole. Cole said
Young,
it.
Cole,
Thank
was
you.
it Cole
When
Young?
he said that wanting change. Oh, what's the saying? Oh, I've forgotten now. No, I can't remember it. But it is, yeah, when you want change, you don't get it. When you accept things and as
Yeah.
they are.
Definitely helped me personally, accepting me and my neurodivergence and the way I am and accepting emotions when they come as well instead of being scared of them. I don't get trapped in them anywhere near as much as I used to. The weeks that would go by where I was paralyzed in well, it was anxiety and depression, but neurodivergent people are more susceptible to that because of the world that we live in. But I don't get trapped in it now. I get trapped in it for a day occasionally instead of being stuck in it for weeks because I'm just beating myself up about it. And then everyone else is judging me and I'm listening to those, comments from my dad. And yeah, self-acceptance is huge and acceptance of emotions as well, learning what they're trying to do for you, because they're all trying to tell you something, aren't they?
Yeah, and
If you
I
can
do
have
think,
that dialogue with them, why are you here? What do you want? What is it you think I need?
Yeah. If there
sorry,
was one thing you could change about how we as therapists approach trauma treatment for neurodiverse people, what would it be?
Learn about it. You need to know that you need more than just your trauma training. You need to know actually that it's not all, like I said before, it's not all, I mean, for want of a better word, fixable, that it's not all trauma. The struggles that a neurodivergent person is going through, a big part of it will be trauma, but a chunk of it won't be. And you need to know that. The self-acceptance part, to be able to educate somebody about, well, this is what your neurodivergence can look like, and you can't help it. It's not your fault.
I was just going to say, I think Carl Jung says we cannot change anything unless we accept it. Condemnation does not liberate, it oppresses.
Yeah,
And I think that is like the bottom line, really. The key to it is self oh God, I
that
can't
one.
speak.
Yeah,
The key to it is self-acceptance. So yeah, and really
yeah,
that's I think as a therapist, I kind of strive to self-accept, accept myself, and then I can accept others. And I think if the client takes that away, that's probably the key thing.
yeah,
really
yeah,
is, especially against a backdrop of thousands and thousands of thoughts about anti-me, which a lot of
absolutely.
people have, to be able to accept yourself against the backdrop of that is an incredible leap forward, isn't it?
Yeah.
I think as well, it's quite good to be light-hearted about it because I'm like, oh God, yeah, I'm like that. I know, yeah, yeah, I do that, yeah, and
Yeah.
it's in a very light-hearted way instead of like being really like serious about it. And yeah, if only I could not do this thing, or if only I could just be a better person. It's
Mm.
like just accept that quirkiness and in a way love it, love that part of you as well.
Yeah.
You just said something there that this morning I was speaking to someone and I just thought, wouldn't it be great if we could teach people to accept their uniqueness? We spend years, especially as children, trying to blend in and fit in.
Hmm.
But actually, someone, especially with neurodivergence, is unique.
Yeah.
We all are, but they, if we could learn to accept that, and like you say, Kay, make a joke, oh, well, that, yeah, sorry, I always did something like that, or no sense of
Mm.
direction, neurodivergent, whatever it might be. Um, Learn to accept it and share it almost. Don't hide it.
Mm. I
Yeah.
spend time with the clients, sort of, because you quite often hear, don't you, all of the things, all of the problems. I can't do this. I struggle with this. Da 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 da. It's about sort of flipping that and saying, okay, but what are you good at? Because neurodivergent people are quite often creative. They have, a lot of my neurodiverse clients, they work in creative roles, you know,
Yeah.
and if you took away the ADHD, you'd take away the creativity, you'd take away the brain that works 100 miles an hour, that comes up with these fantastic ideas. That means that you're able to work in London, say, in a in a role that designs packages for things. And if you took that away, you wouldn't be a musician, you wouldn't be a singer, you wouldn't be that fantastic creative person.
Yeah, and that's kind of how I kind of tweak it. That when I used to work in an office and used to get like challenged on things and structured things that I didn't do, I used to just go, yeah, but I'm not structured, I'm creative.
Yeah.
And a bit of a joke really, and then laugh. And so it was fine. Rather than like worrying about all the stuff I couldn't do and didn't do, it was like, well, I don't do it like that. I'm more creative.
Wow, that
So,
was incredibly forward thinking then, Kay, wasn't it? Because what year was that?
oh God, probably 2015, maybe before that,
Okay.
really. Yeah. So maybe 10 years ago, even longer. Yeah.
Yeah, because people wasn't necessarily accepted quite as readily as it is now for you to
Not
say,
at
yeah, well, I
all.
haven't done that part of the job
Yeah.
because I'm creative and I've done a really good job over here. Look, and then bosses go, there's the door.
I mean, yeah, I mean, they weren't best pleased, but I just laughed because they
Yeah.
wanted me there for something, and it was my creative side. And if I
Yeah.
did it like they wanted me to do it, it wouldn't work.
No, and I'm just thinking after this, I'm going to get a little list of all the famous people that have created and invented wonderful things that we couldn't live our lives without that have got ADHD because
Yeah.
a lot of the creators and inventors have got ADHD.
A lot of musicians have as well. Will.I.am is ADHD. There's lots of famous people saying, I am the quirky actor. I mean, look at Jim Carrey and people like
Oh,
that. And I
is
think if
he?
only schools, and I know like it's getting, well, questionable, but you hope it's getting better. But instead of like when I was at school, when it was all why can't you do this? Why can't you do that? Is to, from a young age, if we can only grasp what they're really good at and nurture that instead of giving them all the negative things about what they can't do, then the chances are of somebody like that growing up to be to be traumatized is going to be less. because they'll be looking at their strengths instead of their weaknesses. I think that's really important for parents to, if the school aren't doing it, for the parents to be able to really get hold of what the kids are good at and go with it.
Yeah, that's lovely because I think we're running out of time. I don't think we've got time to be able to talk about masking now, have we? So we
Yeah.
probably should leave the masking until we
Absolutely.
can reel Beth in for another time, some stage
Maybe
later
get
if she
Beth in
wants to do it again. Yeah,
Yeah.
we can try.
You did really well, Beth.
It was
Thank you.
okay. It was
Yeah.
fantastic. You're a star guest.
Oh, thank you.
So
Okay.
I'll say thank you so much, Beth. We've enjoyed listening to you and hearing about trauma and how it affects the neurodiverse. So until
Thank you for having me. It's been good. Thank you. It's been a good experience.
thank
Thank
you.
you, Beth. Thanks
Bye.
so much for your time.
No
I'm going to say
worries.
bye as
Thank you.
well.
Bye,
Bye.
guys.
Bye.
Bye. Bye.
She was like, oh, excuse me, I'm being stupid again. You're not stupid.
Yeah.
You've got an illness. It's
Yeah.
fine. And so, yeah, I agree. Make light of it and just laugh at yourself and be honest about it. Oh,
Yeah. Well, I
anyway.
guess the fear is when you say that, the fear then comes from people judging you for having
Mm,
that.
mm,
Yeah,
mm.
that's true. I
Yeah.
mean, I think that like, when I was working in the office, I used to, because it's to put a positive spin on it, like I'm creative, I'm not structured.
Mm.
Put a
That's
positive,
really good.
like take the mick out of yourself, but make it positive. That's
Mm.
what I think. Because if you
Yeah.
keep being negative about yourself,
Yeah.
people believe that you're
Yeah.
negative, that
Yeah.
they believe all the
But
negativity.
you're right about the fear, but thankfully, slowly but surely, life is changing. Slowly. So, my name is Sharon Horwood. If you want to work with me, I work online and I also work face to face from Pricklewell in Southend-on-Sea. And you can contact me through my website, horwoodcounselling.co.uk.
Hi, I'm Tamsin Blake. If you'd like to book a session with me, please do feel free to go onto my website, www.tamisinblake.com. I see people in person in Southend-on-Sea, in Clarence Street at Counselling-on-Sea, and I'm also available online. Thanks. Bye.
Hi, I'm Kay Cohen. I work with people about relationships, couples therapy, and childhood trauma. You can contact me through Psychology Today, my professional page, Kay Cohen, Southend-on-Sea. I see people face to face and online.
Well, it's great to see both of you. I'm glad you're both okay.
Yeah.
Thanks ever so much for doing this.